Good morning, and thank you all for tuning in and for being on the phone. You know, a few days ago, on a conference call with hospital providers, Dr. Reggie Washington, a good friend and one of our great medical leaders in Denver from St. Luke's Presbyterian Hospital, reminded all of us on the call that, quote, this virus isn't going away anytime soon. It's going to be with us for a while. And that statement from Dr. Washington became very foundational to me in my thinking about our path forward and recognizing that this is going to be a long marathon, one we are going to have to run together. It'll be a while before we get back to living the way we want to. And that reminded me of the advice I have given my own children as they've grown up. And we must do what we need to do now so that we can do what we want to do later. I know our residents are anxious about what next week will look like in Denver, given the governor's phased relaxation of the statewide stay-at-home order beginning on Monday. I've also had to decide about Denver's stay-at-home order set to expire on April the 30th. These health orders have never been about stopping the COVID-19 completely. They've been about bending of the curve of infections and hospitalizations so our healthcare system could avoid being overwhelmed with desperately sick people. And thanks to these public orders, and thanks to the serious sacrifices of our residents, many indicators show that we are making progress in this effort. But our long-term public health challenge continues, and so does the equally daunting challenge of restoring our economy. From the state, we have 4 pillars of a statewide approach: creating a mask-wearing culture, protecting vulnerable populations, testing and tracing, and physical distancing. Throughout all of this, Denver's had to grapple with unique situations and unique challenges. Our population size, our density, our demographics, the number and various sizes of our businesses, and the number of large entertainment, cultural, and sports venues. In fact, the metro area has many of the same challenges Denver does compared to the other parts of the state, and the governor has been supportive of our efforts to address these unique challenges. After very careful consideration, particularly in consultation with fellow mayors in the metro area and public health guidance, particular to our city, and a very talented and dedicated staff here at the city, and frankly, a great deal of prayer, I decided to extend Denver's stay-at-home order until May 8th. And while we are flattening the epi-curve, Denver's specific metrics of new infections, hospitalization rates, and mortality suggests we are not completely out of the woods. So we need a little more time to scale up our testing and tracing capacity and to provide our residents and businesses the kind of specific guidance they're asking for. Let me say again that the governor's guidance has been helpful for the entire state, and every elected leader is approaching this from the same place, doing what is best for the people of our communities and the whole Colorado, not for politics. We're going to have to take an approach that looks to open up the economy in phases, which is an approach Denver will take, and the governor has also encouraged local jurisdictions to adopt measures specific to our communities. Extending the stay-at-home order to May 8th will give us more time to do the things that are necessary for our community to reopen safely and in stages. It will also give us more time to craft proper guidelines, regulations, and enforcement procedures, and to communicate that guidance to the public. The May 8th date will also afford our residents and businesses the time they need to prepare themselves for life after stay-at-home. The enforcement of any stay-at-home order issued by the city and state requires local enforcement. We are expecting to see the precise language of the state public health order and additional guidance soon, which will be critical to guiding our work. Since we lack a coherent national strategy that supports mass testing, it is up to the states and local cities to do what Washington can't seem to appropriately manage. It is very encouraging to hear on Wednesday, again, the governor confirmed this with me yesterday, that more testing is on the way to our state. Our public health officials in Denver feel that 1,000 tests a day on top of testing for those who are symptomatic should be an immediate goal for our city. I've confirmed that this is an achievable goal, with Denver Health alone soon reaching the capacity to do 750 tests a day. So this is about a coordinated approach around testing, and it's about accessibility for all Denver residents who may need testing. And we will be working closely with our private healthcare systems to supplement and to increase that testing capacity. We are also going to identify and cross-train staff to implement case management, including contact tracing and monitoring and case investigations, as well as increase coordination with our regional public health partners so contact tracing can happen across borders. To overcome the disease, we will need to prepare for future outbreaks, and that is why testing, contact tracing, and procurement of additional PPE are so important. Despite what some of our leaders say, we must be prepared for COVID-19 to continue, and worst-case scenarios include an outbreak during the winter flu season. And given that fact, I want to call on our representatives in Congress to work toward a more thorough testing system so we can get ahead of the curve. Listen, this has been tough for all of us. But I also know it's even tougher for our residents to manage their lives with some hope of certainty. It's government's job in times like this to provide certainty, to speak truthfully, and to base our judgment on the best healthcare guidance we can, not on politics. I've told people from the beginning that we're going to make mistakes. Not every call will be spotless, but I've said before, I'm going to err on the side of saving lives. I want to thank my fellow mayors from around the region, all the Metro public health officials, and Denver City Council for their support and agreement to extend our stay-at-home order on May the 8th. The Metro mayors and public health officials have been phenomenal partners during this situation, and really shows how in challenging times this region does indeed pull together forward. So we're going to take this time to do this right, to do what we need to do now so we can do what we want to do later in just a couple of weeks. I want to thank all the residents for staying strong, for adhering to the orders. It really does mean more than you will know. And this dedication that you've shown hopefully will reward all of us in the near future. With that, I want to turn it over to our public health administrator, Bob McDonald, to provide more of what we're looking at going forward. Bob?
Thank you, Mayor. Before I give an update on where we are and what we're hoping to achieve in the next couple of weeks, I also want to thank all of my counterparts throughout the region, all the public health officials throughout the region who have been invaluable to me in the recommendations that I make to the mayor. So as the mayor pointed out, we are not there yet. We're making great progress. We hope to achieve a great deal in the upcoming weeks, specifically with respect to building out a workforce that can enhance a response to an enhanced testing protocol. We hope in the next couple of weeks and believe that we can achieve 1,000 tests per day. That's going to give us great insight into where we are with battling COVID-19. We have built out and identified a workforce of over 100 people who we hope to train and will train in the next couple of weeks in preparation for that. We're partnering with Denver Public Health and Denver Health and Hospital Authority and other city agencies that are going to help us out with attaining that goal. We also want to be clear that where we stand and with the guidance that we're going to provide to everybody that this impacts, and we're not there yet. We want to put some very targeted guidance together when we do start easing up on restrictions so that everybody has a clear understanding of what they can and what they can't do. And we're reaching out to many people in the private sector to get their insight. We want to collaborate on that. So those are all the things that we are going to accomplish in the upcoming weeks so that as we ease up, we're going to be ready for that. We're going to evaluate our efforts every step of the way, adjust where we need to. But this additional time is going to put us in a much better position to be ready for easing up on restrictions. Thank you.
Thanks, Bob. We're going to go ahead and open it up for question and answer at this time.
I have a question, if I may.
Yes.
Lance Hernandez with Denver 7. Just wanted to ask, the governor is opening up the state. Do you feel, as mayor or as health officials for the city and county of Denver, that perhaps the governor was moving too fast?
Again, Lance, thank you for your question. The governor is responding to data just as we are. And I believe that's why they're taking the appropriate time to put the orders appropriate for us to roll this out, to ease ourselves back into this slowly. But again, when my optics are focused on Denver and the uniqueness of our population and our economy, and how we need to roll this out slowly with all of the protections and guardrails necessary to do it in a safe manner. The governor has been a partner, and I'll tell you that his guidance was very helpful. It actually helps us to accelerate and maybe even not have as long of an order as we might we initially thought we would need. But the orders are going to be important, and it's going to be important for us to adapt those orders to Denver, and that's what we're preparing to do.
Thank you.
Hi, this is Esteban Hernandez with Denverite. Can Bob talk a little bit about how the city plans on getting to 1,000 tests per day? Is there a timeline? Is there like a goal where that testing sort of milestone will be reached? Can you talk a little bit about how the city's going to get there?
Well, I think the capacity is there now. One of the things that we've learned over the last couple of weeks is that, and you might recall this, very early on, public health guidance, even from the federal level, was to not have people rush into the hospital to get tested. Not everybody needs to be tested, and you could run the risk of people bringing in when they're infectious, bringing that into a hospital setting. Apparently, we did a very good job with getting that message out to the public, because now there's a hesitancy or people don't know that the capacity is there now and the systems are set up to take many more people to get that testing done. And so we're working with our partners at Denver Health and Hospital Authority and many others in the medical community to get that word out. That we're expanding on that capacity. We have expanded on that, and we're ready to take more people for that. We're setting up the protocols and the messaging for that. So I believe that we're there. We need to market it more aggressively so that more people are aware of when they could go and where they can go.
Great. And Lance, just to follow up on that question, let me just say this to follow up on that point. I used the term coordinated very intentionally because I believe the power in this opportunity of opening up our economy is strengthened by a coordinated approach of working with employers, employees, institutions to get employees tested. Particularly those who are symptomatic, employers who may say, I want to know if I want all my employees tested before they come back. The goal, of course, is not only to make sure that we have safe environments in which to go back to work in, but also to grow consumer confidence. And if people know in restaurant A or facility B that companies have taken the steps to protect their employees and their customers, then hopefully consumer confidence will grow as well, and thereby strengthening the economy. I'm sorry, you wanted to follow up?
Taking place? Is that Denver Health, or is there going to be another site in the city where people can drive up to? What is that going to look like?
Clearly, Denver Health will be a part of it, but the goal is to have a diversity of opportunities for people to be tested around the city and around the metro region, quite frankly. And, there are going to be some other new wrinkles there. I won't talk about them now, but hopefully we'll make it real convenient for residents all over the city of Denver to get tested, those who are symptomatic, those who maybe are part of an employment program to get tested before going back. That's what we're going to spend the next 2.5 weeks really focused on and drawing out and building and creating that opportunity.
Mayor Hancock, this is Nelson Garcia with 9 News. Do you have any concerns about confusion amongst the public with different orders being issued by the governor and local entities?
Yeah, that's something we spent a lot of time talking about, Nelson, and we hope to bring some clarification to it. The reality is that right now, and for all residents, the current order that we're under will remain in place in Denver, Colorado, in Denver, and you may see other cities follow. I shouldn't say follow, but be a part of the same strategy going forward. And so the way we're operating now in terms of staying at home, businesses not opening unless they are essential operations will remain in place until May the 8th. We will set up a system to where we can answer some other critical questions about that going forward. But the city attorney's office and our communications teams are going to be working fastidiously to make that happen. Next.
Mayor, follow-up question.
Question for Bob, please.
Yes. Bob.
This is Kyle Clark with 9 News. If it's possible to get in a question for Bob McDonald. Bob, the governor has made clear that he wants aggressive enforcement of the workplace limits in terms of the number of people in the workplace. Does your health department have the bandwidth to do all the things you need to do and scale up testing and be the primary enforcers on workplace limits?
Yeah, thank
And
you.
if you could mute your phones, please. We're getting some feedback. Please mute your phone. Thanks.
Thank you for the question, Kyle. You raise a good point about resources being stretched. I do believe we're going to be able to do that successfully. Every step of the way, this has not been an effort solely followed out or carried out by the Department of Public Health and Environment. We've had many partners, great partners throughout the city, safety and community planning and development, excise and licenses, and many, many other departments that have stepped up to assist with every decision, every step of the way, including enforcement. So I do believe we're going to be successful with doing that. That being said, we rely on the public. We rely on employees, if they see concerns, to call that into 311. We've been very successful and rapid in our response with following up on those concerns when they come to our attention.
Mayor Hancock, Nicole Fierro with Fox 31 here. You talk about communicating to the public new guidelines as they come out. Where can we see what currently is in place, what's going to be changing, where can this all be available, and how soon do you plan to have guidelines for businesses that were thinking they would be open May 1st?
Yeah, I appreciate that, Nicole. Very good question. Let me clarify again. Denver's order, stay-at-home order, did not expire until April 30th. And so even with the governor's move toward opening or easing the opening of the state this weekend, Denver's would have remained in place for an additional 4 days. And so we're extending that order out to May the 8th. Again, what we know today is what will be in place up until May 8th. And it's important people understand that the businesses that have been permitted to open up until or during this stay-at-home order considered essential businesses will continue to operate. Those who have not been allowed to open will still not be allowed to open in Denver, Colorado until May the 8th. May 9th. Yeah, as we roll through May 9th. So midnight, May 9th.
Hi, Mayor. This is Connor from Westward. Thanks. So there's a large cleanup set to take place in 5 Points on April 30th. And you've stated your goal is to get people into shelters. I spoke with the Colorado Coalition for the Homeless this morning, and they said that shelters in Denver hovering near capacity. So I'm wondering what your thoughts are on the city setting up a safe outdoor location where people can set up their tents, and the city provides restrooms, sinks, and other amenities to keep people safe.
Yeah, I appreciate the question, and I'm going to bring Britta Fisher up here, our Director of Housing, but I can tell you foundationally that we are working very hard to continue to create indoor opportunities for residents of Denver who are experiencing homelessness. At this time, we don't see a reason for us to create outdoor sanctioned campsites, as you're alluding to, in our city of Denver. We're not going to move in that direction, but we are going to continue to work hard to create opportunities indoors for our residents.
Hi, this is Mike Litwin.
Just answering that last question, this is Britta Fisher.
This is Mike Litwin, the
Chief
Colorado
Housing
Independent.
Officer for Denver. And part of what we continue to do is to gain protective action rooms. I'm pleased to say that people who have been living outside have been part of the outreach effort and been connected to some of those rooms. So I think we continue to work on every support possible, including hand washing and portalets that are outside right now, and understand that there are demands for more, but we continue to try to meet the needs that we have with both rooms and expanded auxiliary shelters, as well as some of those hand washing stations and portalets around the city of Denver.
Somebody else?
Hi, this is Mike Litwin from the Colorado Independent. Mayor.
Hey, Mike. Go ahead, Mike.
So what will Denver look like on May 9th? The state is taking small steps and then larger steps. Are you going to be caught up with where the state is on May 9th, or will you be sort of starting all over again?
The actual public orders coming out from the state in terms of public orders and his executive orders of the governor and how they roll out will be helpful to us to measure and prepare for May 9th when we open up the city. As I've said from day one, this is going to be baby steps. This is going to be a phased-in process, and so we'll see where the state is, and we'll modulate our rollout accordingly. But you can expect, again, this is a marathon. We're going to be in this for a long haul, and we're going to roll out accordingly that we believe will be safe with the proper protocols for any industry that's allowed to open their doors. There may be some on May 9th that are not allowed to open quite yet because we have to put other measures and protections in place. But we're going to be as transparent as possible. Once we get those orders from the governor, the team will go to work and begin to lay out how we will roll out Denver's strategy. Next question.
Mayor Nelson Garcia.
Mayor, this is Ed Seelover with the Denver Business Journal. I was wondering if you could just kind of walk through your thoughts on this. Governor Polis specifically said he didn't want to extend the stay-at-home order for one reason, because it inflicts very severe economic pain on people. How did you kind of arrive at this? How did you balance out the needs of public health and the needs of people to earn a living, particularly as we see more and more surveys saying businesses are going to be closing for good if the stay-at-home order stays in place?
Yeah, we've always recognized that unfortunately there are going to be some casualties to this across our economy. And I'm not just talking about Denver, but I'm talking about worldwide. And we know, and I'm in regular contact with small businesses, big businesses, almost on a daily basis, talking about what's happening during COVID-19 and the economic impact from what's going on. We start with the foundational belief that, one, we're about saving the city and saving lives in this city. That's first and foremost. My team and I just talked about that yesterday. Let's get back to our why. Our why is to save lives and to keep as many people safe and healthy as we can. Secondly, of course, it is about how do we make sure that we can continue to protect the community going forward, even with the presence of the COVID virus in our community. And at the same time begin to open up the economy to try to move back to some semblance of normalcy or whatever the new normal will be. And once we get back to saving lives, we understand that we got to ease into this. And though it's difficult, we have as a society become practiced at rebuilding economies that have been challenged through recessions. We know we can bring back the economy. We know that we can rebuild businesses. We know that we can start new businesses. What we cannot do is replace lives that have been lost. And if that's our paramount focus, then let's do everything we can to protect lives first, and then do what we know how to do best, and that is to rebuild the economy and help companies get started again. We'll do those things. We'll do everything we can to help every business, every entrepreneur to get started again in the new economy. But let's first start by protecting lives.
Mayor, this is Nelson Garcia with 9 News again. Weld County is taking a vastly different approach than Denver. Are you concerned at all that what they're doing may influence the behavior of people in Denver?
No, I believe, first and foremost, I have faith in the people of Denver to help us do what we need to do necessary so we can do what we want to do down the road. Secondly, as every community, just as Denver, every community has to do what's in their best interest. And so while Denver is taking one path, another city, and there may be cities more immediately surrounding Denver than Weld County, they have to take different steps than the city of Denver. Hey, listen, I celebrate that. They had to make their own decisions on that. We're going to do what's in the best interest for Denver and the people who come into our city.
Mayor, Jesse Paul here at the Colorado Sun. One of the things that the governor said this week was that the modeling that he's seen shows that delaying the stay-at-home order or continuing it by 2 or 4 weeks doesn't change, has a negligible effect on the peak hospital bed usage, on the effect on the healthcare system. It sounds like you're seeing different modeling. Can you talk a little bit about why you think we're not out of the woods yet?
I think you need to take a look at the broad brush in which we are approaching this issue. It's not just continue to bend the curve or to decrease the infections. That's extremely important to us. But it's also when we lift our heads, how do we look at this more broadly and further down the road? How do we build into our way of living, our systems, regular testing and regular access and to coordinated testing so that as we enter into different seasons, we are set up to protect residents and we can avoid future peaks, or at least not large of a peak or great of a peak going forward. And so you heard me talk about, yes, let's increase, let's have an understanding of what the gross capacity of testing is in our city. Let's make sure that we coordinate accessibility of that testing for whoever needs it, regardless of their ability to pay, regardless of what station they come from in life. Let's make sure that people have access to that testing all over the city of Denver. And then thirdly, let's make sure we have a system to do contact tracing, which is as critically important as the testing. Who do people have contact with? Let's make sure we're able to track them down. Let's make sure they're informed. Let's make sure we begin to box this virus in. We are no longer working to be driven by this virus. We're working to get on top and to drive this virus, know where it is, and to begin to minimize its impact in the community. That's what we're focused on. We have done the work necessary to create a plateau, to begin to decrease the impact of this virus. Now we need to box it in and make sure it's at our whim, that it becomes our punk, and we're not its punk anymore.
Any other questions?
Mayor, this is Mike Litwin again. How confident are you that May 8th is a hard date and that you could accomplish everything you say you need to by that time?
Yeah, we're going to work very hard to get there, Mike. We got a lot of work to do. I'm not going to mince words with that. The team knows we had a lot of work to do. There were other dates we looked at, but I think it's important, has always been important to me, that the region work in concert. And if we can get the majority of the region on a particular date and try to work together, then May 8th became that date, and I felt much more confident that together we can get there, particularly if we're all focused on similar objectives and goals: testing, contact tracing, and making sure we know how to help businesses adhere to the new realities around the new executive orders of the governor once they're published. Final questions?
Mayor, Ed Seeliger again. I just wanted to follow up. Speaking of working in concert with the region, I think a lot of people saw that Wheatridge is requiring customers to wear masks inside essential businesses now. Is Denver considering something like that? Does it have anything in place? And particularly given all the social media reports you see about people flooding parks without masks these days, how do you look at what the city absolutely has to require with masks?
Yes, I've asked our public health and our city attorney's team to look at doing a mandated mask wearing strategy in Denver. Until we order something, which I hope to be in short order, I'm going to ask everyone, if you're going outside to walk the dog, put on a mask, put on a face covering. If you're going to take your trash outdoor, put on a mask, put on a face covering. If you're going to just go take a walk down a trail, put on a mask, put on a face covering. And certainly if you're walking into a public location, a grocery store, to see your doctor for critical care, put on a mask, put on a face covering. You may save a life. Yeah, Bob McDonald? Yeah, okay.
Yeah, I want to respond or go back to the question about what Weld County is doing, and I couldn't agree more with the mayor that we need to do what's right for Denver. We are looking at what other counties are doing, and we get input from them. I'm not going to speak to the details of what Weld County is doing, but we're going to do, again, what's best for Denver. We're going to try to align with the region and with the governor where we can, but we're certainly not going to defy or be less stringent than what the governor implements. And so that's how we're going to continue to move forward, in alignment where we can, doing what's right for Denver, being in alignment with the state, not being less restrictive than the state. So I just wanted to revisit that. So hopefully that clarifies that.
Bob, thank you for doing that. Apparently, I responded to the question without fully understanding what's happening in Weld County. But in terms of defining the orders of the governor, my statement is about being within the guidance of the governor and in partnership with the governor. And we have tried to do that on every step that we've taken. I would not be standing here had I not communicated with the governor what we were moving to do in Denver, Colorado. And that, quite frankly, it's an honor and an appreciation for his guidance that we are able to develop this blueprint. So not by any stretch of the imagination am I advocating that someone defy the orders of the state and the governor. He has been a tremendous partner and has been a tremendous leader. And let me just say this clearly, because I love the fact that some people try to create conflict where there is none. Colorado is very fortunate to have Jared Polis as our governor at this point in time. He has led truthfully, he has led with transparency, and he's led through science. He believes in science, and he has listened to his public health leaders as they have advised him on decisions to make. I can tell you, I talk to him just about every day, and this is someone who wants to do absolutely what's right for the people of Colorado, and I'm grateful for his partnership. His guidance has been tremendously helpful during this time, and I want to make sure that that's very clear. And Denver, and by no means is going contrary to Governor. We are using what he has given us as a foundation to modify it and make it work for the people of this city. Any other questions?
Mayor, Lance Hernandez again.
Yes, Lance.
Lance Hernandez
again.
again with Channel 7.
This about your fourth question, Lance?
Yes.
Go ahead.
This is just my second one. My apologies. I know that Jefferson County has extended their stay-at-home order until May 8th. Tri-County's meeting at 12:30. The assumption is that they may do the same thing. If they don't, there may be a situation where businesses on one side of the street have to close or remain closed, and businesses on the other side of the street may not have to. We've heard from viewers that are concerned about that. I don't know if you know anything about Tri-County that I don't know yet. I know that they're meeting at 12:30, but can you address that concern?
You know what? Tri-County public health officials, the body there as they make decisions. These are tough decisions for everyone, and they're going to do, I believe, what they believe is in the best interest of their community. We also, all of us have talked regionally, and maybe Bob can talk about the fact that public health officials have been on regular conversation almost daily, as well as elected officials. I can't tell you enough about the mayors around the region, county commissioners who have weighed in and been tremendous in helping us think this through. But communities are going to have to do what's best for them, and I'm hopeful that we have a line date, but in the event we don't, it's a reality we'll have to deal with at the time, and we'll all get through it. The good thing is we're not talking about June 8th, where we're talking about 6 weeks out. We're talking about 2.5, 3 weeks, and I think we will survive during that time. You want to add any comments there?
I don't really have any.
Okay.
Thank you, Mayor.
Thanks, Lance.
Hey, Mayor, this is Connor from Westward. So these are really tough times, but Broncos fans had kind of a fun moment last night with the picking of Jerry Jeudy. Would love to hear your thoughts on the draft choice.
Yeah, I'm going to look over at Evan Dreyer. I was so excited to finally sit down and work on something else other than COVID-19, and the draft was coming on. It was 5:54, and Evan Dreyer calls me from the office, and I said, man, you are so lucky. It's 5:54, and you're early. I am so excited. I want to say very publicly, thank you, Las Vegas Raiders, for not drafting Jerry Jeudy. We got the best wide receiver in the entire NFL draft. I was hopeful, fingers were crossed, that we would get Jerry Jeudy. I think we just got an all-star future Ring of Famer in Denver, and if and when he develops correctly, he and Cortland Sutton with Deshaun Hamilton and other talent on the field, you got a team, an offensive squad that can do some very special stuff with Drew Lock as quarterback. Exciting pick for the Broncos. Well done, John. You took my notes.
All right, I think that's a good note to end on, gang. Thanks so much.
Thank you all.
Thank you. Thank you.